Hello, everyone, and welcome to our webinar on understanding the different types of diabetes medications. And this is part one. We'll be having a second part that you can come to at another time. And then after that, we're going to have a question and answer webinar so that you'll have a chance to ask Kim, our presenter, all the questions you have about both parts of this webinar. But let me introduce Kim Ladd to you. Kim is a registered nurse, and she has been one for over 20 years. She's also a certified diabetes care and education specialist, a certified professional in healthcare quality, and a master trainer for the Stanford University developed diabetes self-management program and chronic disease self-management program. She has a passion for preventing diabetes and its complications through education, and it stems from her own firsthand experience because she and many of her family members have diabetes. Having first taught diabetes management in the home health and community settings for years, 5 years ago, she began working at a state blind and visual impairment agency, and her role there involves empowering visually impaired clients to independently manage their diabetes and other chronic diseases. We're delighted that Kim has been involved with Vision Aware in doing these diabetes sessions. She's already completed some webinars for us, and you can find them in our webinar series on aphconnectcenter.org/webinars, all of her archived webinars. She is also working for us in redoing our diabetes guides that we have in the diabetes section of Vision Aware. So without further ado, I want to turn the program over to Kim. Kim, go for it.
All right, thank you, Pris, so much. And hi, everybody. I'm going to go ahead and share my screen here. I do have some presentation slides, but I will have them as a handout in a Word format available for everyone because this is a whole lot of information. So the slides that I'm using are really kind of to keep me on track so that I don't miss anything. So please don't feel like you have to hurriedly take notes or anything. I'll have the handout available. So let me go ahead and share my screen with my slide pack here. Just give me a second. All right. So as Chris said, this is part one of two. And what I'm going to talk about today is understanding the different types of diabetes medications can help improve your health. I'm going to talk about, I wrote it as by mouth medications. That was my nursing coming out because that's what we call it, PO medications. So I'm going to talk about oral medications because there are injectable, there are inhaled, and there are by mouth or oral medications for diabetes. So I wanted to divide them in chunks so that it's not too overwhelming at one time. So in part two of this series, I will talk about injectable medications, insulin, and inhaled. So today we're just going to talk about the pills that are available. Now these pills, they are for type 2 diabetes. So I'll get into that a little bit more later, but I did want you to know that currently there are over 60 different types of medications to help treat diabetes, and more are being developed every day. So 60, that's a lot. So it really can be overwhelming. So what I wanted to do today with the oral medications was just kind of help explain them in a simple manner, the differences between them and their mechanisms of action, because the different classes work in different ways to help improve your blood sugar levels. And, you know, understanding medications is a very important part of staying healthy. You need to understand it so that you know that the medication's working. If you are experiencing a side effect or a common effect of the medication, something like one of the medications makes you pee a lot to get rid of the sugar. So if you start taking this medication and you notice that you're peeing a lot, that's not actually a side effect. That's the action that you want from that pill. So I go into that a little bit. You also might want to know why I am on so many pills. So as Pris said, my passion for teaching diabetes comes from, you know, my own and my family's experience. So I have diabetes, and, you know, I take 2 different pills for my diabetes. So it's like, why do I need two? Why can't I get it with one? So I hope to explain that just a little bit. So this webinar will help you gain an understanding of the different types and actions of the non-injectable diabetes medications and how they help regulate our blood sugar levels. So just quickly a review, what is diabetes? So diabetes is a chronic disorder of carbohydrate metabolism resulting from inadequate production or utilization of insulin. So when you have diabetes, your pancreas, which is the organ in your body that produces the hormone insulin, insulin is the hormone needed to metabolize carbohydrates. So when you have diabetes, your pancreas either doesn't make enough insulin or your body can't use the insulin that it makes effectively. Therefore, you can't process carbohydrates, which is sugar or glucose, in your body. So that blood sugar stays in your bloodstream instead of being transported into your cells by insulin. So when the sugar stays in your bloodstream, that is what causes the complications of diabetes, because the sugar irritates your blood vessels, your nerves, your organs, and it causes damage. And that is the problem with diabetes. It's not the diabetes per se that causes issues, it's the complications of diabetes that do. So sometimes you need diabetes medications to help keep your blood sugar level within a normal range. So the cornerstone of diabetes management is keeping that blood sugar level under control, meaning your blood sugar level is between 80 to 130 if you check it with a finger stick, or the hemoglobin A1C, which is that test that you get done in the doctor's office that shows what your blood sugar level has been over the previous 3 months. You want that level to be below 7%. Studies and research have shown that if you keep your hemoglobin A1C below 7, you can prevent getting complications of diabetes. And that shows you that your diabetes is well controlled. So one way to control your blood sugar when you have diabetes is to take medications that are developed for diabetes. Of course, the other ways are having a positive lifestyle, meaning exercise, which lowers your blood sugar levels, healthy eating, which means not eating too many carbohydrates, because it's the carbohydrates in foods that converts to glucose in our body, and also lower fats to help prevent cardiovascular problems. And then stress management, because stress, illness, infection all make your blood sugar level go up. So you want to keep your body as healthy as possible. Anybody should, but especially when you have diabetes. All right, so oral medications for diabetes. All medications have a generic name. Well, they don't have a generic name unless they've already been through the copyright process. So I should start that over. All medications have a brand name, and then the generic name comes out, which is usually like, sometimes it's based on the chemical name of the medication. But when a company develops a medicine, they come up with a name. So I'll say like Jardiance, that's a brand name that the company that developed the medicine gave it. That is always a capitalized word. When the patent is up, and other companies can make that same drug, they come up with a generic name, and that name is usually not capitalized. That's kind of how you can tell the difference. So to make it even more confusing, all medications are known by more than one name. So that's another reason why it's so important to pay attention to your medications, so that if you go to the doctor and they call your medicine one name and you say, no, I'm not on that, you actually might be, it just might be the brand name for the medication that you're taking, but you're taking a generic. So, you know, the world of medicine is a little complicated sometimes. So I wanted to throw that out there so you would understand that. So with medications, you know, any medication you take is going to have side effects. What I urge all of you to do is weigh the benefit of the action of the medication for why you're taking it versus the side effects. Hopefully, the purpose of the medication is going to outweigh the side effects that you have. But that is not a decision you should make on your own. If you get started on a medication for your diabetes and you have some of the side effects that we're going to talk about, that's when you need to have a discussion with your doctor and your healthcare team to determine, are there ways I can help prevent the side effects? Is this the best medicine to help my blood sugar levels, so I just have to learn to put up with the side effects? Or is there a different medication I can change to? So that's another reason I wanted to go over all of these medications, so that you can start asking those questions of your healthcare team. Another good resource is also your pharmacist. They are the specialist in medications. So if you are having a side effect or something, or have questions about your medication, the pharmacist is a great resource. I want you to do all of this so that you can be a part of the informed decision process about what the best medication for you and your particular situation is with your diabetes. All right, there are some ways, you can learn some information on your own by using the internet. However, I just urge you to be a little bit careful about what sources you use, like chat sites, or, what is it, Reddit? I'm not sure what people put in questions and then people answer it. I would take all that with a grain of salt. I mean, usually it's lay people answering the questions. So I would urge you, if you want to know information about your medications, that you use reputable websites. So in the handouts that I have for this presentation, I have listed 3 resources for you. One is actually the medication's own website. So say Libby Company makes a medication, say it's Jardiance. You could actually type in Jardiance and search and go to that medication site information, because it will list everything about the medication that you want to know. In more layman's terms, 2 good sites are Medline Plus and then the Mayo Clinic. They tend to break things down to where it's easier to understand, and you can trust their information because it is put on there by doctors and pharmacists. All right, so oral medications for type 2 diabetes. There are actually 9 different classifications of medications. Now, like I said, I'm not going to go into every single thing about every medication, but I just want to give you some highlights so that if you're on that medication and it piques your interest, or you come up with a question, you might get the answer in this presentation, or you can just wait till the Q&A session and send that in, or ask your doctor or pharmacist. All right, so the 9 classifications are Maglinides, sulfonylureas, I'm probably butchering these names, SGLT2 inhibitors, DPP4 inhibitors, thiazolidinidines, or known as TZDs, Glucosa inhibitors, Maglinides, dopamine receptor agonists, and bile acid sequestrants. I don't know why all the medical names have to be so long and hard to pronounce. So, someone else might pronounce them differently. I'm doing my best with that, so bear with me. All right, so the first classification group that I want to highlight are the Maglinides. Now, there really only is one Maglинide anymore. And it is known as Metformin. And I'm sure most of you have probably heard of this medication. It's also known as Glucophage. Metformin is the generic, and Glucophage is the brand name. There's also some different concentrations of it. There's a liquid metformin, and that's known as Riomet. So if you have problems swallowing the pills, metformin pills are kind of big, so some people have difficulty swallowing them. So you could ask for the liquid form. Metformin is usually taken twice a day with meals. However, there are extended release options. They are known as Glucophage XR. Anything that has like an XR after the name or an ER after the name stands for extended release. So you know that that's a once a day pill. Glumetza is also a once a day metformin, and Fortimet is the other one. I mostly see metformin or Glucophage XR in my practice. I haven't seen the other ones very often. Sometimes the Riomet will be for kids because metformin is approved for children 10 years and older with diabetes. Metformin is basically the first line medication given to anyone diagnosed with type 2 diabetes. Now, I did want to say, because I failed to mention it earlier, all of these oral medications that I'm going to talk about are for people with type 2 diabetes. The two main types of diabetes are type 1 and type 2. Type 1 is actually an autoimmune disease where your body attacks your pancreas and destroys its ability to produce insulin. So if you have type 1 diabetes, pills are not going to help you. You have to take insulin. If you have type 2 diabetes, I like to call it that your pancreas is tired. So your pancreas is still producing some insulin, but it just doesn't make enough to keep up. So you need to help out your pancreas by giving it pills, watching what you eat, and exercising. So all of these oral pills are for type 2 diabetes. All right, so back to metformin. Like I said, it is the first medication any doctor should put you on when you are diagnosed with type 2 diabetes. Actually, more than 150 million people worldwide use metformin, and it is the fourth most prescribed drug in the United States. That tells you how rampant diabetes is around the world and in America. Basically, 1 in 3 people in America have prediabetes or diabetes, and part of them don't even know that they have it yet. So, I mean, diabetes is a huge issue in America and the world, and diabetes is the #1 cause of blindness. That's kind of why I work in the blindness field, to help people. If people have low vision issues from diabetes, you can't get your vision back, but if you properly manage your diabetes, you can prevent your vision from getting worse. And also, I like to do preventative things for people that have diabetes like me. I still have my vision, but I need to be vigilant and take my medicine and do what I need to do to help prevent blindness in myself. All right, metformin does have a lot of gastrointestinal side effects. Basically, nausea, bloating, and diarrhea are the main side effects of metformin. Personally, I've been on metformin for 15 years, and I still get the GI side effects. But I did what I urge you all to do, is I, did my pros and cons. Is the metformin helping me? What side effects am I having? Is the action of the medicine worth the side effects? And I personally decided that it was worth having some GI issues because the metformin was working so well for my diabetes. But that is a personal choice. There are some things you can do. If you take the metformin with food, it tends to decrease those side effects. That helps for me mostly. When I do, sometimes when I take my medicine and then I forget to eat or get into something and I don't eat, that's when I usually am in the bathroom with GI problems. So either taking your twice a day metformin with breakfast and dinner, or if you could switch to the once a day metformin and just take it in the morning or in the evening with your dinner, that tends to cut down on those GI side effects. So don't just stop it. Have a conversation with your doctor about maybe what you can do to help ease that down. Metformin's been around a long time. It was actually developed, France started using it in the 1950s. So, it's a pretty safe medicine. There's a lot of data to show the safety of it. In the USA, it came out in 1994. And then in 2002, the generic became available. So another great benefit of metformin is that it's a cheap pill. Metformin, if you go to a pharmacy that does the $4 generics, it's a $4 generic. So like big companies like Walmart and a couple other big pharmacies, they participate in the generic program. So you can get a month's worth of metformin for $4 or 90 days worth for $10. So if you have a problem with finances, metformin is a great pill to help you with that. All right, another side effect of metformin is B12 deficiency. So that's something that your doctor can check with blood work and things like that. If you experience any of these symptoms, which are severe side effect symptoms, you need to stop taking the metformin and call your doctor immediately. And these are extreme tiredness, weakness, or discomfort, stomach pain, decreased appetite, deep and rapid breathing or shortness of breath, dizziness, lightheadedness, fast or slow heartbeat, flushing of the skin, muscle pain, or feeling cold, especially in your hands and feet. It's a very rare side effect, but I just want you to be aware that if you start metformin and then you start having these symptoms, that's something you need to stop and call your doctor. Some other benefits of metformin is it actually lowers your cholesterol. It does not cause hypoglycemia or low blood sugar. So metformin is one of those pills that, if you took it and you didn't eat, you might get the GI upset from a side effect, but it's not going to drop your blood sugar like some of the other pills we're going to talk about. So that's one reason it's a little bit safer than some of the others. How metformin works is your liver plays a part in controlling your blood sugar level. Your liver stores blood sugar and then releases it when your blood sugar gets low. But sometimes with diabetes, that function doesn't work like it's supposed to. So how metformin works is it decreases the amount of sugar that your liver lets out into the body. So it helps to keep your blood sugar low. Metformin tends to lower your A1C level by 1 to 2%. So say your A1C level was 9 and you go to the doctor and they start you on metformin. Once it starts to work, which is a couple weeks, your A1C, without doing anything else, any lifestyle changes, it should go down to 8 or 7. But, if your blood sugar is 12 or 13, you still want that A1C to be below 7. So just doing the metformin might not do it. You're going to also have to do some other things. But because metformin is such an important medication and most people with type 2 diabetes are on this medication, I have like a little 2-minute video that I want to play from someone other than me that kind of explains how metformin works. So give me 1 second to get that up. Let me find the right page. Here we go.
Metformin in 2 minutes. Let's begin. Metformin is an oral medication that is commonly used for lowering blood sugar in patients with type 2 diabetes. Metformin belongs to the biguanide class of medications due to its chemical structure. However, it is the only biguanide that is currently used as an oral anti-diabetic medication. So how exactly does metformin work to lower blood sugar? Very simply, metformin increases the activity of a protein in the body called AMPK. AMPK is an enzyme that is responsible for the regulation of multiple metabolic processes in the body. The primary mechanism of action of metformin is on the liver. Activation of AMPK reduces the amount of glucose that is produced by the liver, resulting in lower blood glucose in the body. Secondarily, metformin also acts by decreasing glucose absorption in the intestinal tract and improving glucose uptake from the blood by the body. All these mechanisms of action act to reduce the amount of glucose in the blood. Metformin often takes at least 2 days to start having a blood glucose lowering effect, with maximum effect in 2 weeks. The most common side effects that are seen with metformin are related to the GI tract. Nausea, vomiting, diarrhea, and abdominal pain are commonly seen in patients that are newly started on metformin. These side effects are often transient and resolve over time. They are also dose-related, so patients will often be started on a low dose of metformin initially to reduce side effects, before going up on the dose if the patient is tolerating metformin well. A long-term side effect to look out for is vitamin B12 deficiency. Long-term treatment with metformin reduces vitamin B12 absorption and this can be monitored for with blood tests.
All right, so that's it for that. Let me go back to my presentation slide here. So that's everything you probably wanted or didn't want to know about metformin. So like I said, I spend a lot of time on that just because it is such a popular medication for diabetes. All right, the next classification is sulfonylureas. I don't know why I have a hard time pronouncing that. So these medications work by increasing the release of insulin from your pancreas. Basically, they tell your pancreas to make more insulin. However, these pills will only work for you if your pancreas is still producing some insulin. So most people that have type 2 diabetes, their pancreas is still producing at least some insulin. So this will work for you. These are actually the first medications developed to treat diabetes, you know, besides insulin. These were the first pills. They came out in the 1940s. So there have been tons of research done on these medications for their safety and efficacy. These you usually take these pills, and they are known as glyburide, which is also known as diabeta, glipizide, which is also known as glucotrol, or glimepiride, which is also known as Amaryl. These medications, you want to take them with meals. The major side effect is low blood sugar or hypoglycemia. So you never want to take these pills and not skip and not eat. You never want to skip a meal with these medications because you will get hypoglycemia. So if you skip a meal, your blood glucose level will go too low with these medications. So you need to make sure you stick to a meal schedule and eat even if you are not hungry to ensure that the insulin has enough glucose to process throughout the day. So that's the main side effect with these. Also, if you tend to drink a lot of alcohol or you are malnourished, glyburide, which is probably the most popular of these drugs, you are more likely to have hypoglycemia in those cases. Usually you take it once or twice a day with a meal. And these tend to also lower your blood sugar levels by 1 to 2% on your A1C. These are the cheapest medications. So once again, if you do not have insurance or your insurance does not pay for some medications, these are also $4 or less a month or $10 for 90 days. So this is another good choice if you have some money issues. All right, the next classification, these are sort of new. My days tend to seem to all go together, but these I believe were developed within the past 10 years. Maybe a little bit less, and they are SGLT2 inhibitors. These are also known as glucoretics because they decrease your sugar reabsorption in your kidneys. What happens is your kidneys hold on to the sugar and then you pee it out. So if anyone's ever been on a diuretic for like high blood pressure, or you have swelling or edema and they put you on a diuretic medication, that medicine works by your kidneys collecting the fluid in your body and then you pee it out. So this kind of works the same way, but with sugar. So the action of this medication is to make you pee a lot. So, you know, when you're on this, sometimes you wonder, am I peeing a lot because my blood sugar is high, or am I peeing a lot because the pill is working? So that's why, you know, you need to make sure you monitor your blood sugar level to make sure it's not because your blood sugar level is high, since peeing a lot is a sign of high blood sugar. All right, so these pills, the names for them, now the generic, they all end in flozin, F-L-O-Z-I-N, like water goes flozin. That's kind of how I remember it. So if I see canagliflozin, dapagliflozin, empagliflozin, or ertugliflozin, I know it's a pill that's going to make me pee out sugar. Now the brand names for those are Invokana, Farxiga, Jardiance, and Stiglatro. Now I know I've seen a lot of commercials on TV for especially the Farxiga and the Jardiance. I think I see the Jardiance one every single day. So I know some of you all have heard of that one. Personally, I take Jardiance. I like it. I do, of course, use the bathroom a lot during the day, and it also makes me thirsty. So I always have to drink water. So I'm drinking water during this presentation. So please excuse me for that, but that's why. But the thing I like about this medication is I did have some swelling, in my ankles and my hands. And because of the action of this medication, not only has it lowered my blood sugar level, but it also got rid of the edema or the swelling that I had. So these medications actually help prevent cardiovascular heart failure or cardiovascular events. So it kind of has a dual purpose, which I like that, because cardiovascular events, heart attacks, are the #1 complication of diabetes. So kind of with this medicine, you're helping two birds with one stone, so to speak. But some people can't tolerate having to go to the bathroom all the time. So that's one reason they might not take it. Another side effect is you tend to get a lot of urinary tract infections or genital infections. So you have to stay on top of that. Personally, I've never had a UTI before, but when I started taking this medicine, I did get one, but I've only had one in 5 years. So, it's not that you're going to get them all the time. It's just you have to remember to stay healthy and clean and things like that. So side effects are low blood pressure, urinary tract infections, increased urination, genital infections, ketoacidosis. Canagliflozin also has increases your risk of amputation. If you have kidney problems, meaning your GFR, which is glomerular filtration rate, if it's less than 45 to 60, meaning you have some kind of kidney failure, this is not a medicine for you because it works your kidneys. So that's a conversation with your doctor. Benefits, I mentioned, it does help reduce risk of cardiovascular disease, heart failure, and it does help preserve long-term kidney function. It does not cause hypoglycemia or low blood sugar, and it does not cause weight gain. Most people tend to lose about 1 to 3 pounds from this medication because it helps get rid of the extra fluid that's in your body. They tend to lower your A1C by 0.6% to 1.5%. All right, the next classification are DPP-4 inhibitors, and these are also known as incretin enhancers. These medications prolong the action of the hormones in your gut, which increases insulin secretion and delays gastric emptying. They work by blocking the action of DPP-4, which is an enzyme that destroys a group of gastrointestinal hormones called incretins. Incretins help stimulate the production of insulin when it is needed and reduce the production of glucagon by your liver when it is not needed. So basically, it helps to balance out sugar and insulin in your body through the actions of your gut. So, there's multiple organ systems involved in diabetes blood sugar management. So this one, the DPP-4 inhibitors, work on your gut and your liver. So these are known, the generic name for all of these in gliptin. So if gliptin, Gliptin, is at the end of the name, it's a DPP-4 inhibitor. So they are known as sitagliptin, is also known as Januvia. Saxagliptin is known as Onglyza. Linagliptin is known as Tradjenta, and allagliptin is known as Nesina. The side effects of these medications are headache and flu-like symptoms. They can also cause severe disabling joint pain. If you have severe disabling joint pain, after starting these medications, you want to immediately call your doctor and stop the medication. You also want to report signs of pancreatitis. Saxagliptin and allagliptin can actually increase the risk of heart failure. So signs of heart failure are shortness of breath, edema, and weakness. So, these medications aren't for everyone, but they do work well for some people. The benefits, no weight gain, and they do not cause hypoglycemia episodes. They also tend to lower your A1C level by 0.6 to 0.8%. All right, the next classification, boy, this is the one I have a really hard time saying, thiazolidinediones. I don't know if I'm even going to try. Anyway, most people call it TZDs because we can't pronounce it, but they're also known as glitazones because glitazone is in the end of the name of the medication. So these medications increase insulin sensitivity in your body. They reduce circulating fatty acid concentrations and lipid availability in your liver and muscle, and this improves sensitivity to insulin. Basically, they help insulin work better, and they help lower insulin resistance from your cells, so your pancreas doesn't have to work as hard. These medications are pioglitazone, known as Actos, and rosaglitazone, known as Avandia. The side effects of these are edema, which is swelling in your body, mostly around your ankles or in your hands or your legs. They do cause weight gain as a side effect, macular edema, and heart failure. These medications also have a black box warning, which means a very severe warning attached to these medications. So they may cause or worsen congestive heart failure. So if you are on these medications, because maybe it's the only medicine you can take for your diabetes, you really need to monitor yourself for signs and symptoms of congestive heart failure. And they would be a weight gain of 1 to 3 pounds overnight or increased swelling. Also, they may also increase the risk of bladder cancer and peripheral fracture risk. So these are I don't see these medications a whole lot. I think probably because of the side effects they have associated with them. But this is one that if, maybe for some reason you have liver issues or kidney issues and you can't take some of the other medications, this might be one that you take. So just because you're on it doesn't mean it's a bad thing. It just means you need to pay attention to your body and some of the side effects you may or may not have. So these TZDs medications tend to lower your A1C level by 0.5 to 1%. All right, the next classification are glucosidase inhibitors. And these medications delay the absorption of carbohydrates from the small intestine, which has a lowering effect on your post-meal blood glucose and insulin levels. Basically, it slows the digestion of food with complex carbohydrates like bread, pasta, potatoes, and corn, which keeps your blood sugar from shooting up after you eat. So these medications are acarbose, also known as Precose, or Miglitol, also known as Glycet. So the side effects of these medications are GI in nature, meaning gas, diarrhea, bloating, and abdominal cramps. To help prevent the GI effects, you want to start a low dose and then slowly increase the dose over 4 to 8 weeks. If you do have liver or kidney problems, these are probably not medications you want prescribed to you, but that would be the decision of your doctor depending on the problems that you do have. They can cause low blood sugar, so you need to be aware of low blood sugar symptoms in you and monitor your blood sugar level so that you can treat it appropriately. These medications tend to lower your A1C by 0.5 to 1%. The next classification of medications is Maglinides. These directly stimulate the release of insulin from your pancreas cells, and this lowers your blood sugar levels in your body. Because they work by stimulating the secretion of insulin, they are only useful in patients with some beta cell functions because they tell your pancreas to make more insulin. So these are another pill that you have to have some insulin producing effect from your pancreas, because this pill is going to tell your pancreas to make more insulin. So if your pancreas is too tired to make any insulin, these pills are not going to do any good for you. These pills are known as Repaglinide, also known as Prandin, and nataglinide, also known as Starlix. You want to take these medications with meals. Otherwise, your blood sugar will drop and you will have a hypoglycemic episode. So this is another medication aside from the sulfonylureas that we talked about earlier that you want to make sure you do not skip a meal with. Another side effect of these pills is they cause weight gain. However, they do tend to lower your A1C levels by 1 to 2%. All right, we're almost done. The next classification are dopamine receptor agonists. Now, this is a pill that kind of works with your circadian rhythm. This pill resets your circadian rhythm. It's thought to act on the circadian activities in your hypothalamus to reset an abnormally elevated hypothalamic drive for increased plasma glucose, free fatty acids, and triglycerides in insulin-resistant patients. So within 2 hours of awakening, it augments the low hypothalamic dopamine levels and inhibits excessive sympathetic tone within the central nervous system, which results in a reduction of post-meal plasma glucose level due to an enhanced suppression of hepatic glucose production. So what does that mean? Basically, this medication works directly on your brain to help it process dopamine. This in turn can increase your sensitivity to insulin so that your body doesn't need as much of it. So honestly, I've never had a patient with diabetes on this medication, but it is still an acceptable diabetes medication that works for some people. There's only one medicine in this class, and it is called bromocriptine mesylate, also known as cyclosec. The side effects of cyclosec are nausea, vomiting, dizziness, drowsiness, lightheadedness, tiredness, constipation, or headache. You want to take this pill within 2 hours of waking so that it affects your circadian rhythm at the right time of the day. And it does tend to lower hemoglobin A1C levels by 0.6 to 0.9%. Okay, bile acid sequestrants. This medication decreases your cholesterol levels and your blood sugar levels. It is a class of drugs called bile acid binding resins. So bile acid is a natural substance that your liver makes out of cholesterol. So this medication works by removing bile acid from your body. This causes your liver to make more bile acid by using cholesterol, and that is how it reduces your cholesterol levels. However, after all of that, we really don't know how it works in lowering your blood sugar level. We just have research studies that show that it does. So the medicine in this class is colesevelam hydrochloride, also known as Welchol. Welchol is the brand name. Now, this is a pill that I take for both my cholesterol and my blood sugar level. The thing that I like about this pill is it really doesn't have a whole lot of side effects. The side effects are GI in nature because this pill is working in your GI tract. So basically it's, like constipation, sometimes stomach pain. If you have a history of bowel obstruction, this would not be the pill for you. You also want to make sure you drink enough water to stay hydrated so you don't get constipated. The one bad thing about this pill is it can decrease the absorption of certain medications. So like if you take glipizide for your diabetes, this medicine is going to affect how your body absorbs glipizide. So glipizide would not be a good choice for you if you also take Welchol, and also some vitamins, it affects the absorption of that. So sometimes what you have to do is take the Welchol and then, wait a couple hours before you take other medications. And you also, it helps if you take this medicine with your meal to help cut down on the GI symptoms. It tends to lower your LDL, which is the bad cholesterol, by 15 to 30%. and it tends to lower your hemoglobin A1C level by about 0.5%. So it doesn't have a huge effect on your A1C, but if you have high cholesterol, this might be a good choice for you because it's definitely going to lower your LDL cholesterol. And then you also might get the added benefit of lowering your blood sugar level. The one downside that I have with this is it is a horse pill. It is a big pill, and you have to take 6 pills a day. So you're taking 3 pills with one meal and 3 pills with another meal. So that's really kind of the only bad side that I have with it, but I got used to taking them. So it just became easier the longer I was on it. And I love that it's lowered my cholesterol. So just something to think about if the doctor says you have high cholesterol and they want to put you on something. If you have some, if you don't really want to go on, one of the lipid lowering agents, that you see advertised on TV all the time, this might be a good choice for you. All right. So now kind of what they've started doing is, because most people that have diabetes are on more than one pill. So what drug manufacturers have started doing is combining medications into one pill. So I'm not going to go through all of these. I have them listed in the handout, but I just wanted to make you aware of them, that these are not new medications per se. The fact that they're a combination pill is new, but what they're doing is taking existing diabetes medications and they're combining them into one pill. So like Glucovance is a pill that has glyburide and metformin in it. So instead of taking 2 pills, you're going to take 1 pill. So it helps people that have a lot of medications to take, to cut down on that amount. Another one that I've seen a lot is Janumet, which is sitagliptin and metformin in 1 pill. So like I said, I have a list. There's about 2, 4, 6, 8. There's about 15 of these or so. The problem that I have had, like a lot of times the insurance companies will not pay for these combination pills because they're more expensive when they combine them. So if your insurance pays for them, there's nothing wrong with taking them. It cuts down on the number of pills that you take. But if it's going to cost you $300, $400, $500, and you can get your metformin for $4 and your glipizide for $4, and you're spending $8 and you're having to take 2 pills, that's something for you to weigh as well. Either you want the convenience of 1 pill or you want the convenience of not paying all that money. So I just wanted to let you know and be aware that there are combination medications out there that might help you. All right. I do want to talk about, this is the newest oral medication for type 2 diabetes. And I know I've seen commercials every day for this one as well. It is called Rybelsus, also known as semaglutide. It is a GLP-1 receptor agonist. It is also known as an incretin mimetic, meaning it mimics incretin. Remember, we talked about that incretin a couple slides ago. So this medication increases insulin release with food. It also slows gastric emptying, promotes satiety, which means it makes you feel full longer, and suppresses glucagon, which is the sugar that comes out of your liver when your blood sugar drops. So it helps your liver from not releasing extra sugar, helps you feel fuller longer, so you tend to eat less food, and it also increases your insulin release with food. So this is kind of the first pill that does all 3 of these different things. You do want to take this pill on an empty stomach when you first wake up with a sip of plain water. Then you need to wait 30 minutes before you eat, drink, or take any other medications. Side effects of Rybelsus are nausea, stomach or abdominal pain, diarrhea, decreased appetite, vomiting, and constipation. Severe side effects are low blood sugar, pancreatitis, which is inflammation of your pancreas, vision changes, or kidney problems. The benefits of Rybelsus is it tends to lower your A1C by 0.5 to 1.6%, and you also get weight loss out of this. People have lost between 3.5 to 13 pounds while on Rybelsus. So, like I said, this is the newest one that I know of that has come out in the past few years. All right. So this is a slide. It's not on your handout. It was just me that I'm just kind of sharing with you. It is just telling you kind of the most popular diabetes pills in America. They are metformin, of course, that's the number one. The SGLT2 inhibitors, those are the ones that make you pee, so you pee out sugar. The GLP-1 receptor, that's the Rybelsus ones, the DPP-4, the ones that I can't pronounce, the TZDs and the sulfonylureas. I just thought that was kind of interesting. As I went through, I kind of told you which ones were the most popular, but that just tells you that I didn't make it up. This is from the American Diabetes Association. All right, so the next slide, this is tiny print. It's not meant for y'all. I just have it on here for me to discuss with you all. So this is, I wanted to explain a little bit why you're probably on more than one medication for your diabetes, and also why you could have two people with diabetes and they're on different medications. This is kind of the algorithm that doctors use to determine what kind of diabetes medication they are going to put you on when you are diagnosed for diabetes. Now, of course, this is type 2 diabetes, because remember, type 1, you're on insulin. So type 2, they tend to always start you on pills. The pill they start you on, well, first they want you to try to get it down through diet and exercise. So if you change your lifestyle and you eat healthy and you begin to exercise, if your A1C level does not come down, then the doctor is going to start you on metformin. That is always the pill they start you on. So usually when you start on metformin, you tend to stay on metformin. And then what they'll do is they'll add medications to it if the metformin alone is not keeping your A1C level down. So like with me, that's what happened. I was started on metformin. And then I've had diabetes about 15 years. So then about 8 years in, the metformin wasn't helping to keep my A1C below 7. So they started me on Januvia. And then Januvia, I tended to have the flu-like symptoms with that one. So I didn't really like the side effects that I got with that one. So that's when I was switched to the Jardiance, which is the one that makes you pee. So I've been on that one plus metformin now, you know, for maybe 5 years or so. So right now that's helping me manage. And then I'm also on the well call because my cholesterol went high. So I get a little bit of the lowering of the blood sugar level from the well call. So basically you could say I'm on 3 medications for my blood sugar. And, you know, 5 years down the road, I might have to go on 4, or I might have to switch to insulin. It's not that me or anyone else with diabetes is doing anything wrong, but, you know, diabetes is a chronic progressive disease. It is damage to your pancreas. So sometimes you could do everything perfect. You could eat the perfect number of carbohydrates. You could exercise an hour a day, 5 days a week. You could control your stress. You could take your medications like you're supposed to, and your A1C still goes up. And that is through no fault of your own. It is because your pancreas has just wearing out. So eventually, most people with type 2 diabetes tend to need insulin as well. And like I said, in part 2 of this, I'm going to discuss the role of insulin in that. But right now, let me get back to this algorithm. So metformin, they always start you on. And then this little algorithm gives the doctors a clue. So it says, if the metformin alone is not keeping the A1C below 9 or in range, then you can add another medication. So it gives this little box and it says like, so the DPP-4 inhibitor. If the person wants to lose weight and you want to get the A1C down and it's not too expensive, you would choose DPP-4 inhibitor. DPP-4 inhibitor doesn't change your weight. It does lower your A1C pretty well, and it's less expensive than some other medications. So if you find out that that one's too expensive, you could go to the sulfonylureas, which unfortunately has a side effect of gaining weight, but it does significantly lower your A1C and is super cheap. So that's kind of how the doctor makes the decision. They pick one off of the second list. So then if you're on metformin, so say they put you on metformin and then they put you on glipizide. So you're on those two, and then you still are not reaching the target level of 7% or below in your A1C, then there's another section over here that kind of explains if you need to add another medication, this is what you should add and why. So I just wanted to let y'all know that's kind of how they do it. What medicine they pick depends on the desired outcome, which, you know, is to lower your blood sugar level. But also, you know, if someone that is trying to lose weight, you would not give them a pill that makes them gain weight like glipizide. You would want to choose something else, because the more weight you have, the harder it is to control your blood sugar levels. So that's why there's so many different choices and people are on different medications. You know, like my father has diabetes. He's on completely different, I mean, he's on metformin, but then he's on Actose. So he's on that medication because that's the one that works best for him. And I'm on Jardiance. So even though we're genetically close, we're still on different medication regimens. So I hope that kind of clears it up a little bit. Now, I have some other resources that I wanted to share with you in the handouts, because some of these medications, like the Jardiance that I'm on, I thank God that I have good health insurance, because it cost $862 a month. If I did not have health insurance, I would have to pay $862 a month for that medication. And, you know, I just, you know, who has that kind of disposable income? So what I've included on the handout are some resources for cost savings. The first one that I have is each of the manufacturers of the medications, they all have patient assistance programs. And I have included the link that takes you to that page that lists all of the companies. Like Eli Lilly makes some medications. They have a patient assistance program. Usually it gives you a discount, or they give you, you know, a month free or something. I sign up for as many of these things as I can, because even sometimes my copay on some of my medications is $100. So I'll use my health insurance and then I'll sign up for the manufacturer rebate, and I'll end up paying $20 a month instead of $100. So I am not ashamed to save money. So I say do whatever you can to save money, because medications are so expensive. Some other information that I have on the handout are medication discount programs. So these are things like GoodRx, Optum Perks, Single Care, Script Save Well RX, Blink Health, RX Saver, and AARP prescription discount cards. All of these they all have little different guidelines in them and what you get out of them. Some of them charge you, like RX Saver actually charges you a monthly fee of $60. But it's a program that basically you get your medications for $60 a month. So you pay $60 and they provide you with the medications. They only provide certain medications. So that's something that you would have to research to see if you would qualify for that. But one like GoodRx, anybody can use. There's an app on your phone you can use, and it works with VoiceOver or TalkBack on your phone, or you can go to the website. Whether you have health insurance or not, you know, I always do this. I'll go to GoodRx and I will type in the name of my medicine, and then it'll ask you what your zip code is, and it'll bring up the price of that medicine at all the pharmacies near you. And sometimes the price can be lots of dollars. So, you know, say my copay is $60, but I find the medication on GoodRx for $25. I'm going to go to that pharmacy and get it for $25 and not even bill my insurance for it. So, I mean, there's things you can do about that. Also, a lot of people that have Medicare drug plans, they tend to get into the donut hole near the end of the year, to where you're responsible for like 85% of the cost of the medication. So you could use GoodRx to find a lower price, and then just not even worry about billing Medicare, and wait till January 1st to use your Medicare again when your program starts over again. So I just have that information in there for you to look at if you need a way to save some money on the cost of medications. There are also some pharmacies that have discount programs. These usually require enrollment, and they usually charge a nominal annual fee. However, many medications and diabetes supplies are free in this program. So I'll use my dad as an example. He has Medicare, but he does not have a Part D. He does not have prescription coverage with his Medicare plan. So he goes to Sam's Club Pharmacy. They have a medication program that he pays I literally think it's like $39 a year. I cannot remember, but it's this very nominal amount. And he gets all of his diabetes medications for $4 a month, and he gets his diabetes strips for $4 a month. So what they'll do is they charge you a little annual fee, and then they give you huge discounts on most of the popular medications. So I just wanted to put that out there. So you know about it. The pharmacies that I know about, I'm in Virginia, so these are the ones that I'm most familiar with, but there might be some in your local area. Kroger Pharmacy, Walgreens, Publix, Sam's Club, and CVS. Those are the ones I know of that have pharmacy discount programs. All right, and then I wanted to end with, when you take diabetes medication and you have low or no vision, I urge you to empower yourself to be responsible for your medications. Do not let blindness be an excuse. I see it every day. That's what I do in my role, is I help people with low or no vision. One of my main roles is to help them manage their medications independently. So, research your medications. You can go online, use your JAWS or your NVDA or whatever software you have, so that you can use your computer. You can use Siri on your phone. If you have an Echo, you can ask Alexa questions about things, and she will, you can say, hey, Alexa, go to Medline Plus and tell me what it says about metformin. And Alexa will tell you. You can also talk to your doctor, your nurse, your diabetes educator, or, like I said, your pharmacist. So, I urge you to find out about your medications so you know what you're putting in your body and what kind of side effects it should have. Also, have a safe way to identify your medications. There are things like Script Talk, which is available at many major pharmacies, that it reads your prescription bottles to you. One of my webinars that I do at a future date will be about accessibility and managing medications. So stay tuned for that, but I'm just going to talk a little bit about it right now. So Script Talk is available to read your prescriptions to you. CVS just came out with Spoken RX. It works kind of like Script Talk, but it's through CVS pharmacies. You just call your CVS pharmacy and tell them you want Spoken RX, and they will put a special label on your medications. You download an app and you scan it, and it will read aloud your medication bottles to you. A lot of pharmacies also will provide Braille labels or large print labels. Just ask your pharmacy. A lot of times they have resources that you don't know about because they don't really broadcast it or not. I also urge you to develop a medication management regimen that works for you. It might be that you fill a pill box once a week and you take your pills out of a pill box. You can do that with low or no vision. Just like with anybody else, it just takes practice and patience. Or you put all your morning pills on one side, all your evening pills on the other side. You still check them to make sure they're right, but the ones on the left are the ones I'm going to take in the morning. Or you could put bump dots. A lot of times I will put one bump dot on the lid of pills that are taken in the morning and two bump dots on the lid of pills that are taken in the evening. And that's just another layer of safety for verifying medications. But, work with your blindness training program in your state, or your doctor or your diabetes educator on a regimen that will work for you. Just because you're blind does not mean that you cannot independently manage your medications. And then I charge you with educating, advocating, and activating. So educate yourself about your medications, advocate for yourself with your doctor and your pharmacist, and activate your medication management system. All right, so I am losing my voice now. So that's all I have for part 1. Like I said, the next section will be part 2, and I will talk about insulins and injectable medications for diabetes, as well as the inhaled insulin that is out there. So I thank you all for joining me. And like I said, all of this information will be in the handouts when you sign up for the webinar. So look over those, and when we have the Q&A session, just let me know. Thank you.
Thank you, Kim. We really appreciate your doing this for us today. And we hope that people will listen to part 2 and come to the Q&A section with all of their questions ready for you. So thanks again. We appreciate it.
Thank you. Bye-bye.
Bye.